Hi, everybody. Thank you for joining. Okay, let's get started with the pre-op bariatric diet. So my name is Christian. I'm the nutritionist here at Mexico Bariatric Center. I have a Bachelor's of Science in Clinical Nutrition from UC Davis. Here you can find my email address and my direct phone number. You can either email me, text me, or call me at this phone number. And then here we have our TikTok, is just at Mexico Bariatric Center. And we have some cool, fun videos that you can watch there, and it's a very good resource. Yeah. If you have any medical questions, please email our surgeon liaison, Jen. She's a medical doctor, and she will be able to help you with any kind of medical questions. Here's her email, jen@mexicobariatriccenter.com, and here's her phone number. Okay, so today we're going to talk about the purpose of the pre-op diet and the pre-op diet itself. The purpose of the pre-op diet is not to lose weight. That's not the main goal. The purpose of the pre-op diet is to shrink your liver, begin behavior change. Weight loss is an added bonus. And then the meals are a very good practice for post-op. This will help you with changing your eating habits before the surgery so you can fully take advantage of the surgery on post-op. This is the BMI, or basal metabolic index. This is how we determine how many days the pre-op diet should be. If your BMI is under 32, it's only 2 days of clear liquids. If your BMI is between 33 and 39, it's only 1 week, and so on. It goes all the way to 8 weeks if your BMI is higher than 60. So yeah, in this phase, you want to start to learn healthier eating habits. You want to focus on quality food sources like whole foods, ditch the processed or fatty foods. And like I said, patients who follow the diet have a higher chance of success after the surgery, and it will also help with an easier recovery or less incision sites. And also, it's a good time to learn about portion control. So yeah, use the pre-op diet as a guideline for even after post-op. This is going to reframe your whole eating habits, and it's just going to help you in the long run. Now we're going to talk about the pre-op diet itself. So during the pre-op diet, you want to focus on lean protein. You'll have 2 to 3 meals with 4 to 6 ounces of lean protein. And here are some examples of lean proteins. Chicken, lean ground beef. It has to be at least 90-10 lean. Eggs, fish, salmon, lean steak. You can do things like top sirloin or flank steak, for example. Turkey, edamame. Edamame is actually one of the highest protein content vegetable out there. So if you are vegetarian or vegan, edamame is a very good source of protein. You also can use tofu and tuna. For vegetables, you can have unlimited fibrous carbohydrates. And here on the left, you'll see some examples of the vegetables that you can have. For example, cauliflower, cucumber, any kind of leafy greens, all lettuce, broccoli, carrots, green beans, pickles. This is a question that I get a lot. If you can have pickles on the pre-op diet, and yes, the answer is yes. You can have pickles. You can have any kind of fermented food. Avoid potatoes, corn, peas, squash, and pumpkin. The reason you want to avoid these vegetables is because they are starchy vegetables. And the whole purpose of the pre-op diet is to eliminate all starches and to shrink your liver. And starch is one of those carbohydrates that gets processed really quickly by the liver. And it's one of the reasons that you might have fatty liver and so on. And then you can have 1 to 2 servings of healthy fats per meal. And some example of healthy fats are oils, but olive oil and avocado oil. You can also use coconut oil if you want. Avocado itself is a very good source of healthy fats and fiber, actually. Nuts, you can do salad dressings. For salad dressings, I recommend using a very simple olive oil and lemon or olive oil and vinegar dressing. Those ones would be the best ones. But if you want to get a store-bought one, I recommend the brand Skinny Girl. They have a lot of options. Um, they have low calorie ones. They have zero sugar, low fat. So if you want to check out some store-bought dressings, I recommend Skinny Girl. You can find it at pretty much any store. I've seen it in Winco, Walmart, Target. So yeah, that's a good option for you too. You can do nut butters. You can have peanut butter, almond butter, whatever kind of nut butter you want. And then seeds. These are all very good sources of healthy fats. Avocado, nuts, and seeds also have some good fiber. So if you're lacking fiber, it's a very good way to introduce some. Now let's talk about everything that you should be avoiding. So like I said, all starches, including breads, pastas, rice, tortillas, baked goods, even tortillas like the low carb ones, I want you to avoid them completely. Please limit your fruit intake to only one apple, half a banana, or half a cup of berries per day, and avoid all sugar. It's important that you read the labels. Try to avoid all added sugar. Processed meats like bacon, salami, bologna, sausage, and beef jerky. I want you to avoid those ones. Potatoes, corn, peas, popcorn, squash, pumpkin. These are all starchy vegetables, so you want to avoid them. And also avoid all dairy. That includes milk, cheese, yogurt, cottage cheese. Any dairy is not approved on the pre-op diet. Also, you have to discontinue alcohol, drinks that are carbonated and containing sugar, like sodas, um, energy drinks, sweet tea, and you must discontinue all of these, so alcoholic beverages, caffeine, vitamins, and supplements 2 weeks before the surgery. It's very important because they can increase the chance of bleeding during the surgery and after. So you want to avoid all of these. This is a rule that I like to introduce on the pre-op diet because a lot of people have a hard time adjusting to it. This is a lifestyle change, but it's very important for post-op that you stop drinking 30 minutes prior to the meal, during the meal, and do not drink anything until 30 minutes after the meal. Rapid gastric emptying can happen if you drink during meals, and you also add a lot of volume to your stomach, which can lead to stretching your pouch. So you want to get used to this lifestyle change during your pre-op diet because it sounds simple, but it's very difficult to think about like liquids and just eating. So try to start getting used to it now. That way you're going to have a better chance of adhering to it on the post-op diet. Is Prime considered an energy drink? They do have a Prime energy drink. So that one is an energy drink. I think it's carbonated too, so please avoid it 2 weeks before the surgery. Um, yeah. Anyways, so now we're gonna check your knowledge. I'm going to start a poll. We'll take a minute to for everybody to answer, and we can go from there. I'll go over them after. And please hold all the questions towards the end. We will have time to go over all of them. Okay, I started the poll. If everybody could try and answer these questions. We're going to wait another 20 seconds and I'll go over them. Okay, good job, everybody. So is bacon a good source of lean protein? The answer to that is no. Bacon is not a good source of lean protein. It has a lot of fat and it's also processed. What about tuna? Tuna is an excellent source of lean protein. It barely has any fat and it has a very high content of protein. So tuna is a very good source. Bacon is not. When should you stop caffeine, vitamins, and alcohol? You should stop all of these 2 weeks before the surgery because all of them have a chance of increasing bleeding during the surgery and after the surgery. Here I have two recipes that you can use on the pre-op diet. We have this roasted salmon avocado salsa, and then the cucumber noodle Greek salad. These paired together can be actually a very good weeknight meal. If you want to entertain people that are coming over, it takes very little time to get them together, and they're very delicious. For example, the salmon, you just have to cook the salmon like you normally would. And then you can make the avocado salsa with one avocado, some lime, tomato, cilantro, and jalapeno. These are optional, of course. If you don't like either of these ingredients, you can avoid them. And then for the cucumber noodle Greek salad, you pretty much just chop everything and you put everything into a bowl. It takes less than 10 ingredients, and you can do, like I said, the tahini, for example, dressing. It's 2 tablespoons tahini, lemon juice, olive juice, and some mustard. So dressings can be fun, and they are allowed on the pre-op diet. You just have to make sure you add the right things to them. Let's talk about protein supplements. I recommend having 1 to 2 protein shakes per day. They will keep you full longer. They will prevent sugar cravings and stuff like that. Whenever you do choose a protein supplement, please make sure it has at least 20 grams of protein and less than 5 grams of sugar. It's important that you check because some of them can have a really high amount of added sugar. So make sure you stick to those. So at least 20 grams of protein and less than 5 grams of sugar. And you can do any kind of protein supplement. You can do a whey isolate. You can do plant-based, egg white, whatever you like, as long as they have these two requirements. So the 5 grams of sugar, less than 5 grams of sugar, and 20 grams of protein. You can also just buy pre-made shakes, or you can buy the powder. The powder usually comes out cheaper. So if you want to save some money, I recommend the powder. For the pre-made shakes, I recommend Premier Protein or Fairlife. Those ones are great. Actually, I have one of them right here. So this is just the Fairlife one. This one for you guys, it would not be okay because it has 7 grams of sugar. So avoid this one. This one has too much sugar in it. But the other one they have with only 26 grams of protein, it's more adequate for your needs. And then you can mix the powders with water or unsweetened almond or coconut milk. Here are some recommended protein powders. You have the Vegas Sport one, Naked Pea. You can do the California Performance Co. Or Gain is also good. So you have some options. If you're not sure about a certain protein powder or protein shake, you can send me a message with it and I'll let you know if it's okay. But these are the only two things that are important about it. At least 20 grams of protein and less than 5 grams of sugar. If you want, you can get whey isolate. It's just a more processed form of whey. It's better absorbed than whey concentrate, and it also has a higher protein content and a lower fat content. For the clear liquids, this will be 2 days prior to your surgery. So 2 days before the surgery, you're not supposed to eat any solids. You can do water, clear broth, or bouillon. You can do chicken, beef, vegetable, bone broth. You can even do miso. If you are doing the miso soup, please remove all the solids and just drink the broth. You can have sugar-free Crystal Light, Powerade Zero, Gatorade Zero, any kind of the sports drinks with 0 calories, 0 sugar. The 0 sugar water packets are okay. So Wendy, you can have the sugar-free water flavorings, sugar-free Jello, sugar-free popsicles. And here I want to bring attention to this right here, the protein waters. A lot of patients seem to not read this recommendation, but protein waters are approved on the 2 days of clear liquids. They are made with whey isolate, and they have 0 sugar, 0 fat. They only have protein. And the two that I recommend are Protein 2O, Premier Clear. You can also buy Seek, Isopure, Clear. Those ones are all great options. And if you want, if you find something that you are interested in, you can just send me a picture of it, and I'll let you know if it's okay on the 2 days of clear liquids. Circle is okay on the clear liquids. It's just an aroma. It's not anything in it. Okay, let's do another poll real quick, and then I can go over them after the 1 minute passes. Do we need to do light on salt or regular? It doesn't matter. We don't control for sodium. If you have any pre-existing condition, please follow your recommendation from your doctor for sodium. Okay, another 20 seconds, and I will go over them. Okay, good job, everybody. Now let's go over them. Can you drink protein shakes during clear liquids? The answer is no. You cannot have protein shakes. You can have protein waters. The only difference between them is the form of protein. Whey isolate doesn't have sugar, doesn't have fat. So that one is okay on the clear liquids, which most protein waters are. Some protein shakes can be whey isolate, but usually they're not. So protein shakes are not okay on the clear liquids. Protein waters are. And here's an example of a protein water. It's called Protein 2O. How many grams should the protein shakes be under? The answer is 5 grams of sugar, so under 5 grams of sugar. And how many grams of protein should your shake contain? At least 20 grams of protein. So good job, everybody. Okay, now let's talk about the bariatric vitamins. It is important that you discontinue all vitamins 2 weeks prior to your surgery, and you can begin bariatric vitamins 14 days after the surgery. Vitamins will improve your overall health and energy. They will help with fatigue, muscle loss, blurred vision, hair loss. So if you are worried about hair loss, vitamins are very important for post-op. They can help with cracked and dry skin, weak and brittle bones, weakness in general, and just nerve damage. So vitamins are very important after the surgery. That's why I want to make sure everybody understands, even on pre-op. Vitamins are crucial after the surgery because your body will not absorb vitamins as well as before. So this is something that you should think about. Here's the ASMBS guidelines for bariatric vitamins. Before I go over this table, I want to make something clear. Wherever you see BMVI, this is just an acronym for bariatric multivitamin. So as you can see here, it says from BMVI. Wherever it says from BMVI, that means that this specific mineral or vitamin can be contained in the bariatric multivitamin. So I recommend that you have a bariatric multivitamin that you take daily, and then either have a separate supplement, or this can be contained into your bariatric multivitamin, thiamine. Just make sure it has at least 12 milligrams of thiamine. If you are vomiting persistently, or it's not going away, you will need to get between 50 to 100 milligrams of thiamine. For zinc, at least 15 milligrams per day. For calcium citrate with vitamin D, for gastric sleeve patients and RNY, you only need 1,200 to 1,500 milligrams. But for BPD-DS, you will need to have at least 1,800 to 2,400 milligrams. For vitamin D, this can be contained in the multivitamin, but also in the calcium citrate. And you want to aim for around 3,000 international units, or 75 micrograms. And then iron with vitamin C, for males with no history of anemia, at least 18 milligrams. And for menstruating female, it's 45 to 60 milligrams. And the iron can be contained in the multivitamin. If it is contained in the multivitamin, you have to take the iron separate from calcium. They compete for absorption, and if you take them together, you might not absorb the whole amount. So iron and calcium need to be taken 2 hours apart. And this will depend on the type of vitamins you have. If your multivitamin has iron, you have to wait 2 hours before you take your calcium. But if your multivitamin doesn't have any iron, you can just take them together, the multivitamin and the calcium. And for vitamin B12, this can ranges from 500 to 1,000 micrograms, sublingual pill or chewable pill, or 1 cc injection or a nasal spray. So these are the recommended vitamins. Have at least one bariatric multivitamin. This is the most important one because most likely it will contain all of the other vitamins in it. They have to be bariatric specific. And for the first 6 to 12 months, make sure you take them. And that's for gastric sleeve patients, need to take it for at least 6 to 12 months. RNY and BPD-DS need to be taken for life because those two surgeries are malabsorptive surgeries. So you have to take them forever. Calcium citrate with vitamin D. Here for calcium, it's important that it is citrate and not carbonate. Calcium citrate will be absorbed by your body better than the carbonate. And then also vitamin D helps with calcium absorption. For iron and vitamin C, the reason it's almost always paired with vitamin C, it's because vitamin C helps iron absorption in your body. And like I said, don't take iron and calcium at the same time. You have to wait 2 hours in between them. And then the sublingual B12 shots are acceptable, but you have to go through your primary care physician. And if you do take an oral supplement, it should be sublingual or chewable. That way, you don't need stomach acids to absorb the B12. And these might change depending on the brand that you get. So if you don't get the Emerge vitamins that I recommend, please make sure to send me a picture of what you're taking, and I can help you with your schedule and how to take them. So hair loss is a concern after the surgery. This may happen in the first couple of months due to rapid weight loss, lack of calories and protein, bad quality vitamins, and misunderstanding the vitamin schedule. So if you ever need any help with like your schedule for vitamins, please let me know. I'll gladly help you. But besides the vitamins, calories and protein are also very important for your hair. Make sure you get your protein in and your calories in, because otherwise you might experience some hair loss. But especially for women, there's nothing to worry about. This might happen initially, but after you're fully healed and you have adapted to the surgery, your hair will grow back if you're doing all the right things. So we have our own brand of vitamins. It's called emergebariatrics.com. We have bariatric specific vitamins. Compared to the generic ones, there are 4 times as much amount of vitamins in bariatric vitamins compared to the generic ones. And you can fill all your vitamin requirements. They're easy for your body to absorb. And we have we have chewable and soft chew vitamins and also capsules. But I don't recommend having capsules for the first month after the surgery because they are so concentrated and you might have a very hard time tolerating it. The generic chewable or gummy vitamins are too high in sugar. Some of them have at least have up to 3 grams of sugar per serving. So imagine if you have to compensate and take more vitamins, that sugar can really add up after the surgery. So like I said, for gastric sleeve, it's recommended that you take them for 6 to 12 months post-op. And for the malabsorptive procedures like RNY and BPD-DS, it's recommended that you take them forever. I will answer all the questions at the end. The one package that I recommend, it's this one. It's called the Emerge Bariatrics Ultimate Pack. It will come with 2 bottles, one multivitamin with iron and a calcium citrate soft chew with vitamin D. And these two alone will cover everything that I've talked about so far. And honestly, the soft chews are really good. They're easy for your body to absorb, and they will fill all your vitamin requirements. So if you want to not think about it, this will cover everything. It's only 2 balls, and you can get it on emergebariatrics.com, or you can just send me a text or an email, and I'll help you with it. We also have a meal replacement. It has 27 grams of complete protein, calcium, zinc, biotin, and it has less than 5 grams of sugar. So if you want to use this as a protein shake, you can, but don't use it as a snack. Use it as a meal replacement. And so far, I've had nothing but good reviews about it. Everybody loves them. They say it tastes just like a smoothie. Here's a comparison between bariatric vitamins and just the generic pharmacy ones. For example, our multivitamin has 12 milligrams of thiamine, which is exactly what you need after the surgery. And if you compare it with the Centrum Adult Multivitamin, you can see here it only has 1.5 milligrams of thiamine. And so it goes like that for almost all of them. Folic acid is double. Our multivitamin has some biotin also, vitamin D, and zinc. So as you can see, they are very concentrated. That's why we recommend bariatric multivitamins. I get this question a lot. People ask me about vitamin patches. Vitamin patches are okay. However, studies are showing that people that use vitamin patches will have more vitamin deficiencies than people that use pills, for example. So you can supplement it with patches if you want, but I don't recommend them being your only source of vitamins. These are not required, but I do recommend them to improve your digestions. I recommend a digestive enzyme because after the surgery, you don't have the same digestive enzymes, and this will help your stomach digest the food better. And so supplementing with this can assist with preventing nausea as well as increased absorption of nutrients. So these digestive enzymes are very good if you want to try them. And they also help break down and digest food. And then also the other recommendation I have is probiotics. I recommend that it's at least 50 billion CFU or higher. It will help create a healthy balance of bacteria. It also helps in digestion. It can boost your immune system. And some studies are showing higher amounts of weight loss in people that are supplemented with probiotics. They will also help absorption of B12, and the two brands that I recommend for probiotics are Align or Garden of Life. Okay, we have one last check your knowledge. Let me start that really quickly. Okay, everybody, we have a minute if you want to answer the questions, and I will go over them after that. Is tuna and water in the can okay? Yes, tuna is okay. You can use it in water or in olive oil. It doesn't matter. Can we drink Gatorade Zero? Yes, you can. Can we purchase all this from at the time of surgery? I don't recommend getting vitamins in Mexico. They might not let you travel back with them. And also they have very, very different rules and regulations about vitamins. You can go to our website and you can purchase the vitamins that I mentioned at any time. You don't have to do it at the time of surgery. Let me just link the website here. So this is the website, and it's called the Ultimate Pack. That's the best one that I recommend. There's other options, but just make sure you talk to me before you choose to buy them, so I can make sure that you are getting all the right vitamins for you. Okay, that's it. Good job, everybody. Let's end this. So, are over-the-counter multivitamins sufficient for post-op? They are not. Bariatric vitamins have 4 times as much vitamins as the over-the-counter vitamins that you can buy anywhere. So make sure that after the surgery, you make sure that you get a bariatric multivitamin. Which vitamins should you take 2 hours apart from each other? The answer is calcium and iron. They compete for absorption, so I want you to take them at least 2 hours apart. Here are some tips and tricks. Hydration is essential. Drink water if you're feeling thirsty. You can also drink a glass of lemon water first thing in the morning. This can help with bad breath also. It can help you lose a little bit of weight. Yeah, have a light breakfast. That way you don't overeat. So don't just skip breakfast. Of course, if you don't have time for it, you can, or you can just have a protein shake. But having a breakfast in the morning will help prevent you from overeating later. So the breakfast is important. Eat enough healthy carbs and adequate amounts of protein and fats, and then healthy fats, and lower your overall fat intake. So try to not fry too many things. If you are gonna fry, just use a very small amount of oil. So you can do like chicken breast, for example. You can add a little bit of avocado oil and just pan sear it. Yeah. I do recommend that you cook your own meals. That way you know exactly what goes in them. There's no hidden additives or anything like that. Um, chew your food well and eat slowly. This is important for post-op more than anything. Make sure you take at least 30 minutes per meal and chew your food to applesauce consistency. Try not to eat with distractions, because if you eat while watching a TV show or something like that, there's a high chance you might be overeating. Exercise regularly. Don't eat right before sleep. I recommend that you stop eating 2 to 3 hours before going to bed and get at least 6 to 8 hours of sleep. Here's some more resources for you. We have a podcast done by our past patients. You can get their perspective and experience having surgery with us. And here's a list of examples of episodes: pre-op diet, post-op diet, exercising after weight loss surgery. And you can find it anywhere. You can go on YouTube, our website, Spotify. Yeah, you can find it pretty much anywhere. Our blog is also a very good source of information. You can just go on our webpage and then you go here to blog, you type whatever you want, and there's a very high chance that you'll find your answer. If you don't, you can just message me and I'll help you with it. And we also have the YouTube channel, the TikTok, blog, Facebook, and Instagram. So make sure you take advantage of these resources. A lot of people are already, and they find it very helpful. Thank you for attending. You have a great rest of your day. Bye.